Hello everyone, I am Dr. Sahana Shankar, consultant pediatric gastroenterologist at Mazumdar Shah Medical Center, Narana Health, Bangalore. 19th of May worldwide is celebrated as World IBD Day. On this day, we aim to increase awareness about inflammatory bowel disease or IBD, which is a long-standing inflammatory condition affecting the gastrointestinal tract. This year's theme for World IBD Day is IBD has no borders, breaking the taboos. Let's talk about it. And that is exactly what we will do in the next few minutes. We will talk about inflammatory bowel disease both in children and adults. To help with that, we have Dr. Uday Shivaji, consultant medical gastroenterologist and clinical lead, an IBD specialist, and I welcome you to this talk, Dr. Uday.
Thank you.
So I will begin by asking Dr. Uday, what is IBD and what are the symptoms of inflammatory bowel disease?
So as you said, IBD stands for inflammatory bowel disease, and this commonly includes two main conditions, which are ulcerative colitis and Crohn's disease. Now, why IBD occurs, it's not very well known, but it is thought to be due to multiple factors. Now, in a genetically predisposed individual, there is an influence of multiple environmental factors, such as diet, pollution, etc., which leads to a change in the diversity of the microbiome. Now, this dysbiosis leads to what is called as immune dysregulation or an overdrive of the immune system, causing self-damage to the intestinal tissue. What are the symptoms? Well, the common symptoms are abdominal pain, chronic diarrhea or loose motions, bleeding in the stools, and in severe cases, weight loss and vomiting. So, Dr. Sahana, can IBD occur in children too? And if so, are the symptoms any different when you compare to adults?
Yes, most definitely IBD can be seen in children too. In fact, 1 in 4 people living with IBD have their disease starting from when they are younger than 20 years of age. Nearly 11 to 15% of children with IBD can have symptoms starting under 6 years of age. Traditionally, we diagnose inflammatory bowel disease in adolescent children, but increasingly we are seeing it in younger children under 10 years of age. When it comes to symptoms, they are very similar to what you experience in adults, but in addition, children can present with just poor growth, that is not gaining weight, not gaining height. In adolescent girls, it can just present with delayed periods, yes, not attaining menarche, or an adolescent girl who has attained menarche can come with secondary amenorrhea or not having regular cycles. So these are the unique symptoms that we see in children. Dr. Uday, there is a common belief that inflammatory bowel disease is seen only in the Western countries and not so much in developing countries such as India. Is this true? And also, what is the disease burden of inflammatory bowel disease in India and around the world?
Yes, you're right, Dr. Sahana. It was previously believed that it was mainly occurring in the Western population alone. Now, unfortunately, there has been a significant increase in India and Asia as a whole. There are multiple factors for